listeners, and welcome to this week's episode. If you're just joining me, I'm Dr. Susan. I'm here with my partner, Dr. Leah Love. We are focused on taking care of women in midlife. That's women just like us who want to feel great now and also create the best chance of having our best life going forward. So today, Dr. Leah is doing a Morpheus procedure for me on my neck. So she's going to tell me a little bit about that. I'll just let you know that several weeks ago, I had this done once. So she's done it for me once before. I can already notice a difference. And she'll tell us more. Like, how many of these should I do?
Well, Susan, that depends. So we're going to do 3 for you because this is your first round on the neck and in lieu of surgery. So after that, if you're going to do them every 1 to 3 years because your results really might last that long, then you could do a touch-up. We also use a product that has growth factors derived from umbilical cord, and that really boosts your result and speeds up your healing to be 24 to 48 hours.
So I'll tell you the first time she did this, which was a few weeks ago, and we did this product that we're going to do today, I honestly looked like I had maybe mild sunburn, just pink for 24 hours. That's it, like nothing else. And when she shows you what we're doing here, it's incredible that the tissue heals that quickly. I'll just say I was surprised, even though I do these procedures myself. Being the patient, it's like, wow, that really was fine in 24 hours. So why do we do this? So a lot of people have a mid-facelift. We've talked about that before. I haven't had anything done to my neck. And so, we feel like the skin's getting a little loose underneath, right? So frankly, even Leah said, your neck looks fine, but, why not get ahead of it? Because when things get worse, like if I were to wait 5 more years, then it's a much more difficult problem to solve. So if you've got a little bit of minor skin laxity under the chin like me, one way of looking at it is that I can avoid having a surgical neck lift because down the road it's going to be more than this procedure will treat, right? So this will treat minor skin laxity, but not, surgical.
Right. I tell patients if a surgical result is a 5, then you can expect a 3 from a Morpheus. If you have a lot of skin that really, truly needs to be surgically removed, though, we're going to tell you that because we do a consultation before as well.
That's right. So it's really important to have realistic expectations. So if you've lost 100 pounds and you have a lot of loose skin, you need surgery. If you're someone like me who's in mid-50s and wants a little bit more of my jawline restored, so to speak, I know it doesn't look bad because she's already done one. This is a really great procedure. So we're going to get started. And then while we're doing it, because it takes a small amount of time, Dr. Leah is going to tell us all about what it is, how it works, and etc. And I'll just tell you that for the last 45 minutes, I've had a very strong lidocaine cream on my skin. Not going to feel it much, if anything. And so she'll talk to you about lidocaine too, because there are some issues with that, right, that we have to think about.
Absolutely, there can be. So one of the things that patients ask is, hey, I want to do my legs, my arms, my face. I want to do it all. And although I love to do that, there's only a certain amount of lidocaine that we can put on you at one time because it does absorb somewhat into the bloodstream. And you could literally have a heart attack and die. You could have a seizure. There's different things that can happen. So we are limited to how much lidocaine we can put on your body at any given time. And this is very strong. This isn't something that you're getting, over the counter like burn cream or something like that. This is far, far stronger.
Yeah, so putting in perspective, something that you might get over the counter might be 3 or 5% lidocaine. This is essentially 30%. So when you're thinking about who might do this for you, if you're interested in Morpheus, what do you look for? I mean, obviously a physician who's very well trained, that would be a good start. And then we're very sensitive about this lidocaine thing because we have seen where it has been a problem, and there are cases where patients have had issues with toxicity. So we do not go there.
Yeah, it's also important, for somebody to have some experience that understands facial structure and symmetry and where fat should be and where fat shouldn't be. So, for example, Susan doesn't have a lot of this, but a lot of patients have increased kind of a fat pad with aging or naturally. So that is something that I can go deeper with the needles and apply more radiofrequency energy because it also has a coagulatory function. I wouldn't do that on her beautiful cheekbones, for example, because that's a place where we're going to lose fat regardless. And so you do want somebody that's not just going around, with a laser and doesn't know or understand those principles.
Yeah. That's right. Now, I'm not doing my face. That was just something that I chose, but you could potentially do really any body part. Certainly, a lot of patients do their face and neck. I'm just doing the neck because that's the part that bothers me. But we have patients do their inner thighs, their arms, or anywhere that you might feel some skin, tummy.
I've done my tummy. I've done my obliques. So.
Yeah. We should not do this at home, but you can do it on yourself if you happen to own a Morpheus machine. Not probably something you're going to do at home. All right. Well, we're going to get started, and then she can talk a little bit more. I know you heard the word needles, and that sounds scary, but I promise you'll see it doesn't hurt so long as it's managed with the appropriate amount of topical anesthetic. And then, like we've said, and we'll say 100 times, you can only do one body part at a time because of the lidocaine issue. Not to mention it takes a lot of time, and the doctor doing its hand would get tired. So you don't want your doctor's hands to be tired, just saying. They need to be fully functioning.
Yes.
Yeah.
All right. Well, we'll get started.
All right. Sounds good.
All right. So we're going to get started here. I'm going to just slightly tilt her. And my depth is not that deep because A, it's the skin, and B, she doesn't have a lot of subcutaneous fat. I'm actually doing a pretty high energy on her, and we go pretty quickly.
So if 1 is like a tiny tap and 10 is like getting your leg cut off, this is like a 2. I mean, it feels like being hit with a rubber band, maybe a very small rubber band. It's like nothing. And now this is with 45 minutes of lidocaine. So without anything, it would be not tolerable. So there is a lot of discussion about the fact that this is a painful procedure, and that is absolutely true. So that's why we use local anesthetic. Okay, so Dr. Leah, you were talking about energy source. So this is not laser. What is this? This is
microneedling, which is the needle puncture with radiofrequency energy, which is different. You're going to have, for example, some of the old CO2 lasers that people used to do, they could really burn their skin and fry it, and they would take them like anywhere from 5 days to 2 weeks to recover. So it's different in that regard. It also applies energy to the dermis, which is this kind of second layer of the skin. And if it's deeper, can go into the subcutaneous fat. So if you did want this done on your abdomen, for example, or the baby pooch, then there's a way to focus the energy so that you can coagulate fat. Otherwise, you can do it the depth more shallow, and you can coagulate tiny little spider veins and little popped blood vessels on the face and skin. That's one of the ways that it helps with improved skin texture and even tone.
So just in lay terms, basically each one of these pops is 24 hot needles that are going into your tissue. It's very hot. That's the radiofrequency, and that's actually, along with the puncturing the skin with 24 needles, that's what would potentially hurt. And I'm not sure if you can see on the video, but it does create a little redness because, Leah, can you just show what this thing looks like? So I don't know if you can see at the end of it, it's a little square, and there's 24 needles, and the depth to which those stick out, we can adjust that. So this is how many millimeters?
You're on 2 millimeters. Right?
Okay, so that's very shallow. So this machine, Morpheus can go up to 8 millimeters, which is that's very, very deep, and that would normally be done under general anesthetic if a patient's having a different type of surgery. So in the office, usually we'll go only up to about 4 millimeters, which is still that's a decent depth, right?
And then here underneath the chin into the fat pad, I'm actually going to go 3 on her.
And also, since I've done this before, typically we'd start a little easier on a patient who hasn't had it done before, but I responded so well, we can somewhat crank it up because we know that I'm fine.
And so I've done the first pass or the first treatment, and then we do a second one. And at this point, I can change the energy and increase it, or I can keep it the same. Again, since Susan does so well, and we also have this wonderful product that we use, I'm actually going to increase her energy.
I truly cannot really feel anything much at all. So it's just fine. Very comfortable.
Okay.
I can tell you. So I've got, once we finish this whole series, I'll post pictures of before and after, maybe, a few months after. But I can tell you, looking in the mirror, I noticed a difference like the next day. So that's quite interesting with Morpheus, that it has an immediate effect as well as a long-term effect. And most of our patients say that, like, the next day you notice a difference, which is kind of fun.
You do have to be patient with that long-term effect.
Yeah, 3 to 6 months before you'll get the full results. But I did notice a difference the next day from just the acute. Basically, it's acute injury. I mean, we're intentionally injuring the tissue. And then what happens? So Leah, how would you describe what happens? So we're injuring the tissue just like with laser, and that causes our body to respond, right?
Yeah, so you're making those little punctures, and so it's an injury, but a controlled injury. Kind of like a very mild sunburn, except this goes deeper, and so your body then responds with inflammation. So there can be a little bit of swelling, but in that inflammation are growth and healing factors like elastin and fibroblast and collagen, and even immune cells that release all of those things. And that's how that process starts. And you start seeing, and I've got on a little nerve there.
That's funny. Sometimes it'll give you like a funny bone feeling.
That is a normal reaction.
Yeah. It's not painful. It just tickles.
Yeah, actually, when I'm doing people's arms around the elbow, they always have a little twitch.
It's not common for patients to say that Morpheus tickles, but honestly, that's about the level of it. But again, cannot state enough, very strong lidocaine in limited amounts for about 45 minutes is a good idea, especially if you don't like pain, which is most people. So it's not, I disagree with this idea that it's like, oh, just suck it up, it's really going to hurt a lot. No, we really try to make it comfortable.
I agree. And I'm also just looking right now, nobody's face is completely symmetrical. So I'm looking at one side and seeing, gosh, is there more laxity than another?
Yeah, and I perceived I had a little more laxity on this side, and Dr. Leah agreed when she looked. So she said, this is, like she said, you don't want to just sort of go to town everywhere. You want to really focus on what the patient needs.
Absolutely. And I'm going to do under the chin here a little bit deeper again. All right. I know, that same place.
That's funny. Right. Okay, so I'm just going to speak to this question of you can get this done perhaps for less money if you go somewhere like Mexico or South America. And no judgment about the skill of the doctors in countries other than the United States, but there are some ways that, because things are regulated differently in different countries, there's different ways that can go wrong, just to say. So I'd be very, very careful with that decision, let's just say.
Absolutely. And do you want to show them the immediately after and then after the?
Are we done?
We are done.
I mean, that was nothing. So you can see I look like I have a mild sunburn. I'm going to go out to dinner tonight. No big deal. I'm not bleeding. Now, sometimes when I've done Morpheus on certain patients at certain depths, you might see little drops of blood because you are poking needle pokes in the skin, but I don't think I'm bleeding.
You've got a few little punctate.
I mean, no big deal. No. Now, this Vitapure, let's talk about that because that cannot go through intact skin. So at this current moment when my skin is not intact, that's when we want to put it on, right? Because it's got a way to get in.
And this is a blunt needle just to
squirt it on.
And again, this is a huge value at our practice. Other places add this on for at least $300 a session. We do not.
Yeah, we include it because we do it on everybody. We just think, why would you not do it? So let's talk about where do you get this from and why is it a good idea?
And so this product is made in the USA and it is derived from umbilical cord. So they get all these growth factors from umbilical cord that otherwise would have been discarded. And sometimes people throw around the word stem cells, but just to be very, very clear, this is not derived from embryos. And basically, when you're over 25, you start precipitously decreasing the amount of growth factors that are in your blood. So if I were to draw my blood or Susan's blood right now and use it, it would be far less effective than this. In fact, there's a little sheet that shows some of the growth factors are 10,000 times what I have in my body right
hundreds
now.
And thousands times more. So the comparison that Dr. Leah is talking about is with platelet-rich plasma, and that's another option that we used to do before this was readily available. So you could draw someone's blood. I'm 57, and so if you drew my blood and then went through the process to turn that into platelet-rich plasma, like she said, the growth factors are really minimal. I mean, I've lost most of them. And this stuff comes from a newborn baby. And so because it changes with age, a newborn baby, and again, it's not the baby, it's the umbilical cord, which would otherwise be thrown in the trash. It has the most. So just a side note on that, because I had questions about it, which you might be wondering. People in certain institutions are offered to donate their placenta if they want to. And so when you deliver the baby, instead of throwing it away, you could choose to donate it to a cord bank. And these patients are screened for everything under the sun. Everything under the sun. They also have to be C-sections just to avoid any chance of bacteria. So very, very carefully screened. And then the product can be obtained from those particular placentas and umbilical cords with the mom's consent, because otherwise it would be thrown away. So it's incredible. It can be used for cancer treatment, for skin treatment, burn treatment, hair growth. So many amazing uses of this incredible stuff that we used to just throw in the trash. So safe. And does it have any blood? It has no blood products in it,
blood
right?
products. No, you
don't have to worry about matching your blood, or
you don't have to worry about impurities. In fact, they send 1 in 3 batches for additional impurity testing even after that. So you don't have to worry about, reactions and things like that, because they haven't expressed those markers to be self or non-self.
So it's really quite amazing. You cannot be allergic to it. That doesn't happen. There's none of that happen. It's frozen, so it's stored frozen at a very low temperature. So we keep it in that manner, and we thaw it out immediately right before we use it.
And you're already less red.
It's incredible. And just another plug for that stuff. I've talked about this before, but we use it for a lot of things. I've personally injected it into a hamstring injury, which had not healed with everything under the sun, steroids, physical therapy, everything, and it got better in 2 weeks. Now, maybe that's because I prayed really hard, but I don't think it was a coincidence. So there's many, many applications for this stuff, just to say. So that's it. I'm done. And I'm going to come back in 3 weeks and do it again.
She's going to wear a 50 SPF sunscreen,
which I do anyway.
All the time. And she can use hyaluronic acid in just a harsh, non-acid cleanser for her skin.
So today I came in clean. I had a shower prior to coming in. So because I've got this Vitapure on my neck, we typically tell patients don't go home and take a shower right away. I mean, I'm probably not going to take a shower till tomorrow, but I'm going to go to the gym tomorrow. I mean, there's really no restrictions.
Minimum of 4 hours. There's varying studies, so we like to say 24 if possible.
Just to be on the safe side. I don't want this stuff to come off.
Right.
It's precious. Think about all these growth factors going into the holes in my skin. Now, realistically, these holes in my skin are going to close pretty quickly. So whatever it's getting in now is going to be doing the job mostly in the next 15 minutes. So exciting. Thank you so much for doing that for me.
Pleasure.
It's okay. So rumors is terribly painful. Obviously not if managed properly. Can you do your whole body? Not wise because of lidocaine toxicity. Should you choose somebody who's really well trained in the United States with products that are monitored? Yes, because things can go wrong and we don't want that. Mm-hmm. So that's it. Morpheus for skin tightening. It's another fun thing we can do. You're already beautiful. You don't need any of this. However, it's a little bit fun to feel good about the way you look. So I'm all over that. And if you want to do it, we're here. Dr. Leah, Brandy, and I, we have other practitioners who are able to offer that for you. So check it out. The link's below if you want to make an appointment. First of all, we talk to you to make sure you're an appropriate candidate because we might say, no, don't do it. Mm-hmm. In fact, probably half the time we say, no, don't do it. So come in and we'll talk to you about it and see if you're a good candidate. And then we'll go from there.
Thanks,
Sounds
guys.
good. If you like this episode, don't forget to subscribe, share it with your friends, and I can't wait to see you next week.